I hope I'm still audible in the online call. We're just setting up over here, so we will hopefully start in 2 to 3 minutes. Thank you.
Check, check.
Hi, everybody. We're about to begin our second to last session for the day in 2 minutes. Just please get what? Oh, sorry. We're about to begin our second to last session in about 2 minutes. We're just waiting on some more people, but for our chair. But just please get seated and we'll get started shortly.
Check.
Hi, Ashwarya. I hope you're here, and I hope you can hear me. Basically, Pallavi Rai was supposed to be presenting at the beginning, but she's running a little late. So I was wondering if you'd be okay with going first with the presentation. We will be announcing it shortly, but I just wanted to check in and see if that's okay with you. Okay, can you hear me now?
Yeah, it's a bit better, but it's still a bit feeble.
Okay, I just wanted to let you know that our first presenter, Pallavi Rai, is running late.
Uh-huh. Yeah, so I got an email saying that we'd be going up at 2:45 Bangladesh time. Is that right? Or is there another change? Hello?
Yeah. Is virtual. Yeah. দেখছিল কোথাও চললো
social protection is. Um, I mean, while ICT is solving a lot of problems, but it is also creating a lot of new ones that did not anticipate. So I guess this presentation or this series of presentations and this session is essentially going to be more about how do we deal with these new challenges that are coming up? I mean, when problems are being solved, there are also these new challenges that are coming up. And the holy grail challenge of going from an incentive realignment perspective and so on. So I guess I mean social protection stuff to beneficiaries. And there are lots of opportunities in this area that ICT is bringing up. And one of them would be to kind of tracking and aware whether the population targets are being met, whether the regional targets are being met, and so on. So these are obvious benefits that are coming up because of ICT. The challenges are that that it is basically posing a new way of doing things for people.
And whenever there's a new way of doing things with in a certain ecosystem, it means that certain incentives are being broken, certain new incentives are being created, certain new skills are getting needed, certain skills are getting outdated. So all of these issues come up from a supply side perspective. From a demand side perspective, now that we have data about who is getting data, what kind of social protection inputs they're getting, now there is an opportunity to kind of analyze this data and come up with various forms of analysis. Things such as whether the right kind of input is being provided, whether the timeliness of these inputs is appropriate or not. So all of these issues that were sort of decided at a policy table with the most elderly and the senior most person at the table taking a lead, uh, that is being broken because now you have data, you have evidence with which a lot of other people can put their opinions forward with. So there is obvious benefit regarding those. But the challenges regarding the beneficiary side of things are regarding, one of the challenges would be exclusion. Because whenever you have a digital system, that means that some people are getting excluded due to data entry errors and whatnot. I mean, there can be a variety of stuff. And then whenever, as we have seen in Bangladesh, and whenever there is an error in a digital system, correcting that error is often not a very easy thing to do. So new bureaucracies are essentially getting created for correcting errors. So there is this pain, a growing pain that we're having to go through because of digitalization. And it's not a case to be made for not doing digitization, but it's just something that we have to realize that this is a growing pain. That whenever you have digitalization, these kinds of issues come forward, and if from a policy perspective these are not guarded against, you have many kinds of issues. The third aspect is essentially using digital means to get cash out, and I guess that is going to be what is going to be mostly discussed from the speakers today. And the obvious are the benefits are very obvious, that you can get cash out to people without middlemen, without exploitation. You can get them on time. You can track whether people are getting them or not. But also there are challenges. Again, challenges, as I was saying, due to proper databases, unique ID being a big challenge that was discussed yesterday, because we don't have a functional unique ID system yet. The policy changes that need to happen because of this, and different kinds of HR issues, as I was saying, that whenever you have a digital means, that when you're giving out cash digitally, it means that a lot of people who are involved in giving out cash in a manual process, they're getting outdated. So what do you do with this huge number of people, especially in the government system? So these people would obviously be not properly incentivized for a digital system to work. So how do you plan for that? So these are the kinds of things that lead to non-sustainability of digital systems often. We often end up blaming the digital system, but really, in most cases, it's not the digital system that is at fault. Digital system takes time to get bug free and then become more and more functional. We get updates from Windows 10 even now. So every digital system will always get updated, will always have errors, but that is often used for making a case for non-digitization or delaying digitization. But the real issue is often very HR related, not digital system related. That's often really not considered enough in policy discussions. The fourth aspect of where digital could be very, very significantly important, and an area possibly not a lot of work is being done, is essentially getting the voice of people. Because digital is not about just getting stuff one way, it's also about the other way. And the other way is essentially capturing people's voices, people's complaints, who are getting what, whether they're getting the right amount of inputs or not, whether they're getting timely inputs or not. All of these elements of people's voices that are very difficult to capture in a manual process, but very easy to capture in a digital process. If you have a system for making sense out of what is coming. But this is an area where very little work has been done so far, and perhaps some of the speakers will allude to that. But having said that, I think I want to kind of say that this space has to be, I mean, if it needs to go through fundamental transformation, it has to be thought of holistically and not just from the perspective of digital cash, where a lot of the work is done. But if it's not thought of holistically from all those four aspects, just focusing on digital cash again may lead to an unsustainable process in the long run. Because as I was saying that, for a system, for a digital system to run, we have to think about the entire ecosystem, all the players, all the incentive structures, all the disincentive structures, and it has to be thought about holistically. So I'm hoping that the speakers will kind of get to all of those issues in one way or another, and we can by the end of the session we can. I mean, the questions that I'm raising, I'm hoping that some of those issues and questions will be kind of addressed, and then we can have a fruitful discussion at the end. So so if I can get a cue on who should be the first speaker. Okay. Mhm. Okay. Okay. Thank you
Aishwarya
so
and
much.
Arushi, I don't know if you can hear me, but whenever you're ready, if you
Thank
could
you so much.
your presentation.
Should I? Yeah. Are they coming up? Yeah. Mhm. So Arushi Gupta, Senior Research Associate, Divara Research India. I hope I pronounced that right. Dwara Research India. Aishwarya Narayan, Research Associate, Dwara Research India. Thank you so much for making the time to contribute to the session. The floor is yours. Thank you.
Hello, hi everybody. Am I audible?
Yes.
Sorry, just getting used to the hybrid format. Thank you so much for the introduction. I'll just quickly start by giving a quick background on what we've done today. Over the last 2 to 3 years, my colleague Ishwarya and I, who are part of the Social Protection Initiative at Dwara Research, have worked specifically on last mile delivery of social protection entitlements. And this is specifically with respect to the cash transfer program that was launched back in 2013-14. And this was mostly direct benefit transfers that go from the treasury directly into beneficiaries' bank accounts under a variety of social welfare schemes. Could be pensions, could be maternity benefits, etc. And what we have here today is some summaries of the research findings that we've collated across a variety of field research projects. This was mostly done in the states of Tamil Nadu, Assam, Chhattisgarh, Madhya Pradesh, Bihar, Uttar Pradesh, etc. And all of these are big states where there are a high proportion of welfare recipients or low-income households per se. And how we went about the empirical research is that we had a conceptual cornerstone to guide us. We had the exclusion framework that's just about to come up on your screen. And we used this exclusion framework to map all points of exclusion where beneficiaries fall through the cracks. So as you can see, we start from the pre-entry stage of a particular social welfare scheme right down to the end point. Now, this entire framework is tethered to the standard operating protocols that the government, both the union as well as the state governments, use to transfer cash into beneficiaries' bank accounts, right? We start with the pre-entry stage, which is the targeting methodology. And what we see is for most of the social protection programs in India, the targeting methodology is list-based. It's a narrow form of methodology where citizens have to be part of a survey and certain attributes related to either their assets, their income, occupation status, caste status are documented. Very typically, either the caste census or the socioeconomic caste census that happened last in 2011. And insofar as you're part of the list, you are deemed eligible to be part of a social welfare scheme. And we've seen that, especially during COVID, this entire methodology sort of ran us into the ground because a lot of people who'd fallen below the poverty line because of the COVID-19 shock basically remained invisible to the government in terms of insofar as people were relying on such outdated surveys, right? So that's number one, that it is possible that you're excluded from the social protection program because you're not deemed eligible, either because the methodology is too narrow or even the way the survey was conducted. So even if there is a latest survey, which I think it's in the works, SECC 2021, but I know because of COVID, there have been some operational delays. But assuming even if you're part of that survey, there are issues with the kind of formula that is used to calculate the poverty line thresholds. There is also criticism that has been mounted against the way enumerators go from door to door, where a lot of village hamlets are completely left out. A lot of people who are not living in pakka houses are left out, right? Now, how the framework works is it assumes that, okay, let's assume that you're visible to the government and you've been deemed eligible for a particular social welfare program. The next possible stage of exclusion comes when you're trying to get yourself enrolled as an eligible beneficiary into the program. Now, given that the targeting methodology is quite narrow, the enrollment process is also quite cumbersome insofar as the documentation requirements are concerned. So it is the onus is really on the citizen to prove that they are eligible or they are in fact the rightful recipient of the welfare cash transfer. And because of this entire framework, what we see is that the enrollment stage is characterized by a lot of documentation requirements. You either have to furnish an income certificate, a caste certificate, or in the case of India, there's this whole narrative around submission of Aadhaar card to prove to the state machinery that you're an eligible beneficiary, you're not a ghost beneficiary, or you're not a fake recipient. Another set of issues that we encountered and we documented at the entry stage or the enrollment stage was simply related to the opaqueness of the application processing. That once you've submitted your application at a government department, you have no means to track it or to even get status updates on it. The third stage of exclusion is the benefit processing stage. Now, assuming that you were deemed eligible and you've been able to successfully enroll yourself under the scheme, there are a plethora of issues that might come when the money is being transferred into your bank account. Now, under the direct benefit transfer system in India, we have a very protocolized way of managing the fund flow. So it flows from the treasury, it goes through an entity called National Payments Corporation of India. And NPCI, or the National Payments Corporation of India, basically hosts a mapper or a database. And that database is nothing but it maps people's ID numbers or their Aadhaar numbers with their bank accounts. So it has to pass through the NPCI's mapper to verify the identity of the citizen. And once that's done, that fund transfer order goes to the banks. And then the banks sort of authorize the payment and release the money into the person's bank account. Now, in an ideal world, the nuts and bolts should work adequately and there should be no issues and there should be a seamless transfer. But that digitized backend of the direct benefit transfer has thrown up a lot of issues. It could simply be the issues that creep in when the data is digitized, and hence it leads to failures at the back end when verification happens. Issues related to know your customer guidelines, where people's bank accounts are either frozen or they are dormant, and hence the credit fails. There have also been issues related to mismatch in Aadhaar and bank account details. And lastly, there are a lot of data-related errors. It could be your spelling errors in your Aadhaar, it could be spelling errors in your bank account details, and also trivial issues or miscellaneous issues related to IFSC code not matching, etc. After the benefit processing stage comes the end point, which is the stage of cash withdrawal, where the person walks into either an ATM, a bank branch, or a business correspondent, a popular model that has sort of come up in the last 10 or 15 years or so in India. But here we see that decade-old issues continue to persist, right? Where people complain that a cash out point is not accessible to them. It's either not situated in the vicinity of where they reside, which is that they have to travel kilometers and kilometers simply to access a cash out point, Or it could be that in case the delivery or the cash out is digitized, and so for instance, in India, we have the AEPS or the Aadhaar enabled payment system, where you simply have to submit your biometrics and you can withdraw cash. However, that biometric authentication fails ever so often if there is a network, there's erratic network availability, or the POS device or the point of sale device is not working adequately, right? Sometimes we've also documented issues related to the behavior of these endpoint or cash out point operators. It could be due to simply a misalignment of incentives, right? There's poor monitoring. They aren't paid well enough by the banks themselves to serve the last of the last mile. And there are also issues related to non-compliance. So for instance, we have the Livelihoods Program, which is the Mahatma Gandhi National Rural Employment Guarantee Act. And under that, you get around 400 to 500 rupees if you work for 2 to 3 days doing some menial labor. Even to withdraw that kind of amount, we've seen that the cash out operators might end up demanding a cut, a 50% cut from that wage itself, right? So those are some of those non-compliance, poor monitoring issues that we've documented in the last mile that continue to exist no matter how much end-to-end digitization has been embedded into the system. So that's broadly the conceptual framework that we've used to document issues. We can move on to the next slide, Ashwara, and I'll quickly sort of skim through the studies that we've done. This one study basically tried to come up with a typology of issues across the delivery chain as discussed, where we tapped into a database that was being collated by a civil society organization during the COVID-19 outbreak, and we analyzed the audio complaints that had come in from people who were trying to access welfare benefits. We can move on to the next one very quickly. The next one was with an organization called Hug Darshak, and we went in depth and we had around a 50-60 question questionnaire. It was a very lengthy questionnaire that we administered here. And we went into the details of how people were accessing their G2P or government to person payments. We talked about what kind of issues they face, and in case they faced an issue, what kind of grievance redress mechanisms that they deployed. Were they related to, did they access official helplines, or did they simply adhere to informal issue escalation that happens, which is basically running from pillar to post to get your issue sorted? The next study was with an organization called CMI, which is the Center for Monitoring Indian Economy, and they are a private organization that in the last 4 to 5 years, they've sort of filled the gap, the data gap in India. They run these extensive longitudinal surveys across waves, and we tied up with them to simply document issues across 80,000 households or so, simply looking at the cash out issues that households face both before the pandemic and after the pandemic. The next study that we conducted was with an organization called India Migration Now. And this was a very small sector-specific study. I think we need to move the slide. Yeah. And this was specifically in the...
And let you know that you have less than 5 minutes left. Please continue.
Thank you. Sure. Very quickly, this was related to the kind of issues migrant workers, specifically in the construction industry, were facing while accessing entitlements under the Building and Other Construction Workers Act. It's a welfare board, it's a legislative body that was set up back in 1996 to provide both cash and in-kind transfers to construction workers. And with that, I'll quickly hand it over to Aishwarya. I realize we don't have a lot of time, but if you could just quickly skim through some of the key findings that we have on exclusion from these.
Thanks, Arushi. So I'll quickly take you through some of the results from these studies that Arushi's just told you about. So one thing that we found was that the processing of applications, and this is something that we see from the Brahmvani study where we analyzed audio complaints, is that application processing is a large issue. 83% of all of the calls that we analyzed actually pertain to this type of application processing, which means a person is really telling us that, look, I've submitted my application, but I don't know the status of it, right? I'm not able to pinpoint where exactly the issue is. If we go to a slightly larger sample size based study, which is a Dwara Hakdarshak study. On the right side, you'll see that 32% of all citizens who faced some issue at the enrollment stage actually say that there is an access related problem, which means even before we can talk about digital modes and things like that, right? There is a very basic problem simply of access, which means that it's possible that the enrollment point, that could be a private owned kiosk, it could be the panchayat level, the village level office, it could be that they are too far away, or that they are not open during the requisite functioning hours, and so on and so forth. So 32% is quite a large figure in that context.
Aishwarya, you have minutes left.
Sorry, I can hear some voiceover. I'm not sure if it's for me.
You have less than 2 minutes left. You have
right. Okay, so I'll quickly then maybe just move to the next stage, which is the back-end processing of payments, right? And so you'll see here that for the most part, 51% of our respondents are actually saying that there are disruptions to the payment schedule. And there is a lack of clear communication to citizens about the reasons for such payment failure, which is interesting because the entire backend is actually digitized. And so the information of why a payment has failed is probably quite readily available at the backend, but we see that that information is not really coming through to citizens. And so they're not really able to give us too much more detail, rather than just saying that, look, the payment is delayed, or I haven't received a payment in a couple of months, and so on and so forth. On the right side here, you will see that the bank account and Aadhaar related category of issues is also quite prominent. There are a lot of issues when it comes to actually just people's Aadhaar numbers, Aadhaar IDs. There may be spelling errors in their Aadhaar, which is quite a large issue. It might be that their KYC norms are simply not updated with the bank, or that their bank accounts are simply not seeded in the NPCI mapper that Arushi told you about earlier. What this does is the reliance on a digital system to actually make the payment actually ends up putting a large burden on the citizen themselves, because all of these things, as per official guidelines and official SOPs, are actually left to individual citizens to actually have to deal with themselves. Again, so this is some results that we have from the scraping of a publicly available dashboard, and I'll just direct you to this number, this one figure, which is 51.3%. And we see that beneficiaries of a farmer income support scheme, right, almost 51.3% of them, which is from a particular district in Andhra Pradesh, actually experience Aadhaar related issues, which really goes to say that even the digital backend system is not really working too very well. And just finally, from the point of view of the withdrawal of cash benefits themselves, we see that network errors, of course, the cash out point being far away is in almost 50% of all cases is a big issue. But even beyond that, network errors and failures are quite prominent, 36.92%, and failures in biometric authentication, which is actually a mode of withdrawing cash at that last mile, is also quite prominent as well. Arshi, would you like to come in to just maybe take a few minutes to summarize our conclusion?
Sure, I'll just take a minute and quickly summarize this. So one thing that stood out for us is that with digitization of the entire delivery chain, there has been a concomitant centralization of processes. So when we spoke to people and tried to understand how they were going about attempting to resolve the issues they were facing, the main pathway was that they were approaching local officials, either to get status updates on their applications or on their payments. And none of it could really be resolved because the entire delivery chain has become a black box. So the local officials, so there's also a breakdown of G2G communication where the upper tiers of the administration should have adequately informed the local tiers of where the application or where the payment is. But local officials themselves have not been trained enough. There isn't enough transparency within how the G2G communication is happening. And that adversely affects the kind of information a local panchayat official, which is the lowest tier of administration in India, can provide to the citizens for whom that is the main go-to point. The other bit is around the issue of accountability. Sometimes when we see a complaint, whether it is related to Aadhaar, whether it's related to bank account, but the sheer participation of these private actors has really made the allocation of accountability very difficult. People don't know whom to hold accountable for a failed payment or a failed application. And that really hinders their process of grievance redress, which is why we see with any of the people we spoke with, none of them really documented officially filing a complaint with anybody. It was mostly informal, it was running from pillar to post, and it was just hoping that maybe the welfare payment comes. And in that process,
Miss
spending a
Miss
lot of
Gupta,
time and energy.
Miss
Yes,
Gupta,
I'll
sorry to
that
interrupt. We'll have to wrap up really quickly. Thank you.
yes, I that'll be all from my side.
Um, Thank you so much for that wonderful presentation, and really highlighting that the exclusion is really, I mean, in a digital system, that exclusion is a big issue. I mean, when it comes to social protection, and often, I mean, even from my experience, I've seen that when we're building digital systems, it's often about I mean, a couple of people coming together, IT companies coming together, and essentially digitizing an existing workflow. And there is not enough of a human-centered design approach, as is often very highlighted in development world. Often, when building these IT systems, that is not taken into consideration, and the focus is more on, this is how the system works. What form do you need to digitize? What reports do you need to generate? The discussion often is around those. And as we have seen here, that the hindrance is not around the reports or the digitization of forms. The hindrance is around incentive structures, people's access to services, one system talking to another. Who would talk to whom, and who would get the information from whom? Who is the onus on if something goes wrong? Whose accountability is it? I mean, does the accountability lie with the beneficiary or with the system? So all of those softer policy issues are often not considered. That often lacks. I mean, leads to challenges in sustainability. Yeah. So we can go to the next speaker, who would be Miss Pallavi Rai from the University of London, a senior lecturer, School of Oriental and African Studies, the University of London. Thank you so much for making the time.
Thank you. Thank you very much, Midul. And thanks to Arushi and Aishwarya, I think they gave us a really good framework in terms of what the processes might be, in terms of how wrong processes can lead to exclusion in digital service delivery. I am going to take it a little further. I gather that the slides will be changed from the back, and I just have to say, I do? Oh, I haven't. Hang on. Right. So as I was saying, this was the first presentation set us up very well in terms of process exclusion. I'm going to take it a little further at a slightly more fundamental level. I'm going to talk about the political economy of exclusion. And Mridul, I know you said that maybe you'll talk about the positive things about digital welfare delivery and what works, and we know what works. And a lot of things are working very well. Transaction costs have come down, matters have become more efficient. Closer? Okay. But what we also need to focus on increasingly is what doesn't work and why. Why is it that things aren't working, or why is it that things aren't being made to work? And I think why they're not made to work is something that we really need to focus on. So the political economy aspect of it, as I was just saying, I think that's becoming more important. So we need to have more conversations with evangelists like you, let's say. And I'm not calling myself a naysayer, but a slight skeptic in terms of what might be possible. So what I'm going to begin with is just giving you some idea of what social protection meant during the COVID pandemic phase. And I'm going to take it further in terms of talking about a governance framework for digitalization. And this is some of the work that we've actually done with BIGD. Imran sitting right here. We've worked with Mehnaz, with Rajiv Chaudhary at Cambridge during the lockdown, and we'll talk a little bit about that. But first, what did social protection mean during COVID? Obviously, it's a no-brainer. They had to be strengthened. Safety nets had to be made stronger. And we've had unprecedented amounts of social protection during these times. Now, what were the responses? Typically, they obviously included reaching more beneficiaries. It was also about providing more to already existing vulnerable beneficiaries. So that's horizontal and vertical reach. also, in some cases, and we'll come to that, newer governance mechanisms and framing for how to reach beneficiaries who were affected by the pandemic. So where we are today is that we have a lot of data, an enormous amount of data, and this is the time for us to assess what worked during the pandemic, what didn't work during the pandemic, and most importantly, bridging this with what were the learnings of digital service and digital welfare delivery during pre-pandemic times, of which there has been extensive work done. I think the earlier presenters gave us exactly what was going wrong with Aadhaar-based service delivery, and there have been numerous examples also from Africa. Aadhaar has been the sort of poster boy for what not to do, unfortunately. And I have to say, what Bangladesh is doing is increasingly becoming a sort of example of what to do. We work in Nepal, we work in Nigeria, and more governments are actually looking at, well, again, the Bangladesh model, so to say, in terms of digital welfare delivery, to see what's been working. Just to give you an idea of the unprecedented nature of spending on COVID social protection from 20th March to 2020 to 14th May 2021. This is from a World Bank database, which is actually freely available, and play around with it. It's a great database in terms of what's available, how many beneficiaries, but this is where I've taken the data from. And you can see the steep hike from 45 countries in March 2020. It went up to, I think, about 222. I have the data in the other slides. And the number of schemes, it's just mind-blowing. From some 105, it's gone up to 3,333. So here are your, these are the numbers, really. 222 countries and territories, because this includes the occupied territories, 3,333 initiatives, 1.3 billion recipients received cash, 250 million in kind. I'm zipping through it because it's all up there, but look at the percentages. Up to 49% from pre-COVID levels, and 4 times the amount that was spent during the financial crisis. That gives you a little flavor of the sums involved and the number of beneficiaries involved, which is why we're saying that what's important for us is to consider the gaps and learn from earlier modes of digital welfare delivery. Because all of this that has now happened, the vertical, the horizontal increase, and the new forms of governance paradigms that are increasing, are going to affect more and more lives. And more lives are going to be affected by digital service delivery. So we need to understand this gap between what happened and what's been going on now. And one of the emerging governance paradigms is something called adaptive social protection. This is from an excellent World Bank document on stress testing for social protection. And it basically borrows from the social protection literature, disaster risk management, and climate change adaptation. What it really entails is that it requires ex-ante planning and investment that includes identifying and defining before the crisis hits. So you're actually talking about amassing data, about processing data, and making sure you have your beneficiary list ready before the next crisis hits, which is why this framework is actually very amenable to do what we call popular conventional development paradigms. Scaling, for those of you who are from development studies, it's what did scaling mean? You pilot something, it works, then you sort of upscale it, usually by a centralized government directorate or one particular technology vendor if it's digitization. And then, of course, it goes hand in hand increasingly with digitization and digitalization. But what we argue is that this emerging framework of adaptive social protection would actually be more successful if we use two frameworks based on combining resilience, and there's a huge sort of fragility to resilience literature coming up around social protection and digitization right now. Combining resilience, anti-corruption, I did say this was a governance framework, and anti-corruption is a big part of governance, and scalability. So a lot of the things that digitization aims to target, which is, well, digitization will make information more transparent, will make who the violators are more transparent. So this is anti-corruption. We can also scale up very quickly because obviously the nature of digitization and digitalization is such that you can deliver very quickly, very fast, because now you know who to deliver to and how much to. So that's scalability, as well as resilience, because one does have faith in technology. So all the three things that digitization and digitalization actually hope to address, we want to address with these two very complementary frameworks. So what is the new scaling framework? This is from an article that was just published by the SOAS Anti-Corruption Evidence Program. You can find it on our website. It says the use of multiple partners and resources to form a crisis network allows for large-scale outcomes instead of awarding it to a single partner. And I'll draw your attention to multiple partners and resources instead of large-scale outcomes that allows for large-scale outcomes instead of awarding it to a single partner. So we are actually turning the conventional scaling framework on its head. We're saying it's not about one centralized method of scaling. You are actually experimenting with multiple delivery partners. And the next point then says, we bring together adaptive and integrated scaling, which involves public players, which involves private sector players and informal community-based players, because this is something that we saw work very well during the COVID response, whether in Bangladesh, whether in the slums in Bombay, in Mumbai. You actually had community-based approaches to targeting being far more effective than in many cases the digital modes of targeting that were initially implemented at those points in time. And reveal competence, it sounds technical, but what it essentially does, it tells us which kind of combination of partners and combination of policy delivery works and which kind doesn't work. So because you are actually deploying multiple partners, multiple delivery channels, and multiple delivery policies at the same time, you can actually see what's working. You can phase out what hasn't been working, and then you can scale up what actually has been working instead of focusing on that one. So it actually makes intuitive sense. It just, it sounds development techie easy. So don't get put off by that word, reveal competence. So this could temporarily mitigate problems of corruption, because obviously if something isn't working, there's either an inefficiency there or there's some sort of leakage there. You don't want that to be implemented. And it can also help consolidate long-term investments, because if something's working, you do want to institutionalize that and carry this on. And the other framework, complementary, is how can something work? How can something be made less amenable to corruption? That's, as Mridul was saying, you work with the incentive structure, you work with the power, capability, and interests of actors in that particular governance context. And this is what Mushtaq was referring to yesterday when he was talking about the power, capability, and interest framework. Without understanding those, whatever kind of scaling you do or digitization you do, you're not going to be able to deliver effectively. So why is digitization an attractive option in crisis responses like adaptive social protection? It's quite self-evident. You need to scale, you need to institutionalize. But what has been found, and this is where I go back to what have you learned from, or what have we learned from earlier responses in the pre-pandemic times. For instance, there is this report on the Ugandan digital identity card, which now actually makes it mandatory to have that digital card, identity card, before you can access services at a hospital. Now, if you're going to start having something as rigorous as that, the problem is not the system. The problem is the decision-making behind the system. The system works. You can have a national identity card. It will work very well. But to mandate that as completely necessary when the changeover hasn't even happened, and in many cases it can happen for political reasons, then there is a problem. You absolutely need to make sure that you have some kind of hybrid system, or what we call redundancy, in place that can take over when digitization is not working. The conventional scaling framework is, as I said, it's essentially a pilot, and then you test it, and then you coordinate it by one vendor or one central government department. But think about it for a second about what fragile states have to go to. They have very poor governance. During a crisis, it is actually even more exacerbated. So when you're centralizing everything, and this is what the earlier presenters talked about, when you're centralizing a government department delivery or through a vendor, there are actually no other means of recourse. And in context and crisis times, this kind of centralized delivery can actually lead to greater corruption, not lower corruption. And that's something that we tend to forget. The other bit is it can be used to scale up data collection, both in terms of respondent numbers, and this is important, data fields, which is what we call function creep in this literature. And that is extremely dangerous because, well, governments don't need all the data that they're trapping about us. And sometimes data can even be collected for very political reasons to exclude, as is happening in the case in India for Aadhaar, and sometimes even in Kenya for their digital identity number. But the Aadhaar is the most egregious example of this kind of exclusion. Of course, the danger of rent capture by tech providers. This is something that we've seen differently, not for social protection, but certainly in the case of the general sales tax platform in India, where you now have a sort of quasi-private government partnership that is pretty much monopolizing the data platform that's been created from the general sales tax, with absolutely no window into what the reasons for capture are, how they're being shared, and in what way at all is that going to be used or leveraged in future times. But that is the hope. That's why a lot of these tech providers come together, work with the government to collect the data. I'm just going to skip because I do know that I'm running short on time. So what is the evidence that we have from pre-pandemic digital welfare? Example from India in Assam. I do strongly believe that Assam is probably the most egregious example of misuse, because you first had to stump up your identity documents before you could even apply in that sense for an Aadhaar. And that left out about 1.9 million Indian citizens from the safety net. And right now they are in limbo, that there is a lot of legal proceeding going on in terms of what the status is going to be. But I think we can all be rest assured that this is not going in a good direction. It is anti-minority. It is being used to exclude. And it all started with something that is actually not even legally mandated in one sense. It's not mandated through the census, for instance, to collect this kind of data. Service delivery extends to data gathering for national security. The Kenyan national ID number has come in for these kinds of criticisms. It's called Huduma number, which basically means your service number. And the Muntu ID scheme in Uganda for accessing healthcare, that actually has left out between 23 to 33% of the population, having the most severe impact on older and poorer citizens. So that gives you an idea of mandating far before times. This is almost like a kind of premature formalization when most of our societies aren't ready for it politically as well as socially. I've talked about most of this, and I know that the World Bank gets a lot of flack for promoting digitization, but today even the World Bank is saying that digital transfers are a normative goal, and I've taken it from the stress test document, and they say that that's because certain groups do not have access to digital financial services. But what's important is it's not just about access to technology, it's missing out on the P risks, the political economy risks, the risk of identity politics, the risk of extraction because you belong to a particular faction that the current ruling coalition is not in favor of, and creating a database, providing benefits or not providing benefits are all the kinds of reasons for which database and digital identification can actually be used. I'm going to skip this, but just give you a quick idea of the alternatives, which is that in fragile contexts, having local checks and balances like the community monitoring that I spoke about work well. The adoption of a new paradigm in scaling, you use multiple networks so you can simultaneously test out what works, digital as well as non-digital sources. Second best, there have been innovative ways of using GPS data to identify beneficiaries. That can be a very good way out. Civil society funding, and I absolutely think conversations like this, civil society donors, academics, those of you who are working at the development coalface, tech evangelists, we need to have more of these conversations in terms of what can go wrong and what we can do together as a community to plug those gaps. I'm going to end here. Thank you.
Thank you so much for that very energizing presentation. In the interest of time, I'll just move to the next speaker. Sorry, Mr. Khandekar Shakawatali. Yeah, do you have a presentation? Okay. Mr. Shakawatali is the founder of Knowledge Alliance and Emeritus Fellow of Unnoyan Samunnoy, an NGO in Bangladesh.
Good afternoon, everybody. So after two Indian colleagues, Bangladesh is a case, is quite different. So my title, Social Safety Net and MFS, that is Digital Financial Service. So I mostly focus on digital financial service, but need to be interface between social safety net, and MFS. So in that context, I try to bring historical outline. Okay, but এটা তো অপারেট করছে না। এটা অপারেট করছে না। So I need to be interface between the social safety net. So very, so categorize the four area. Historically, our social safety net developed. Very quick reminder, that is emergency food and cash related with socio-economic shocks, and poverty alleviation, cash transfer and employment generation, education and training. It is very much related of our social safety net program, core focus, and microfinance and a small loan. So then last 5 decades, that is the timeline of our social safety net development. So you see our core investment now in social safety net, particularly human development, that is social stipend program. It is particularly in primary and secondary. And from that experience, particularly National Social Protection Strategy, we developed in 2014. So 3 core objectives there to get better result. And we are leading to middle income country, so we focus on it. And improvement, program designing, and further effective address to delivery the program. So you see, we face 4 almost the same with India and others, 4 area in social safety net challenges. Amount, particularly in educate, and cost. Cost is one of the important factor here to give the client, and coverage, and targeting errors. You know, almost all developing country, that is the quite natural. So now it is interesting figure for these discussions, I see. So in 2022, 2023, our proposed budget, and if we bring the reference 2021, 22, so 41% of our social safety net budget delivered by cash transfer. So it is a new features, particularly we need to be look at. And beneficiary, you see target almost 3 crore, more than 3 crore. So it is a very big number in that context. And most of them are primary and secondary and other stakeholders. So you see, I try to bring digitization jump, particularly in Corona time. So that's the figure from Bangladesh Bank. You see number of MFS accounts also be increased, and the daily delivery, daily transactions also be increased very, very fast. So cash transfer, particularly why we are interested to bring cash transfer. It is a historical linkages there. For that reason, I try to be interface with with MFS development and cash transfer. So you see, reduce the cost. So I have Hossein Zillur and me, we have a very interesting exercise. That is when it is distributed by bank. So quarterly that amount deliver, and big amount need to be shared to collect this money. But now when we transfer in MFS system, so that is reduced almost 8%, 2%, with 2% cost we do it. And it is targeted properly targeted. So target error also be decreased. So KYC, through that KYC, we can give the particular patient. So better access and quality service. But you see, after that, I bring two case studies. Very, and try to identify the new challenges for that purpose. So school stipend program, particularly, it is related with regular universal program. So you see, there is a governance issues and political issues also be political economy in different way that is there, and micro governance issues also be there. And another case study I bring in Corona time, particularly RMG worker, they get their salaries through MFS. And it is a special type of program, and it is directed by a Prime Minister office. So you see, in governance issues, regular program have some inherent governance concern issue that I try to bring in my case. So you see, school stipend program, you see. So school stipend are bring, it is in 215, we started MFS to giving our stipend program. So almost 8 years experience we have. So, but you see, voices issues is very much important. Almost 1 crore 40 lakhs mothers, they are beneficiary, but they have no choice to select their own MFS operator. So that is the issues I need to be bring. Then amount transfer very directly. So it is a very qualitative change, because through bank in rural set, sometimes money is not available, and managers and other staff, they can delay that money in different way. But electronic payment, so it is a real-time payment. But still now, selections of MFS operator, it is a governance issues. You see, it is a hand-pick model. In 2014, when that project start, Rupali Bank and Sure Cash, they start that program, and you see their coverage, their strength is not to give that kind of service for the people, but particular ministry, they select that operator. So you see, core objectives cannot be reached through that way. So that is very small thing, but big thing in governance issues. And Prime Minister opened that program, but same types of previous corruption, not corruption, it is not corruption, it is one kind of misgovernance that I call it is a misgovernance. Because Ministry of Finance, they have an order in favor of the beneficiary. Beneficiary can choose their operator, but particular ministry is not following it. That is the issues. So in Indian perspective and Bangladesh perspective, the political economy is quite different. We are a little bit ahead, but micro governance and specifically we need to be engaged in the policy making. Not only the policy making, we need to be pursuing. So follow-up is very much important. And I am very sad for that issues. It is very big issues for the people, but civil society and think tank organization, academia, they are not proactive in that kind of agenda. And last, yes, thank you. So I think sometimes micro governance and micro agenda is very much important, particularly for Bangladesh to improve this system. So excess, so other thing is fine, but that is the core problems of our cash transfer, select the operator, and that is the political economy agenda. I try to bring the second point also. After sure cash, Bangladesh Bank have an inquiry and there is some corruptions, and same model also be followed. Handpick model, Nogod bring that follow-up, and still now they are not getting Bangladesh Bank clearance. So, so the first presentation, when we are hearing the word compliance, so in context of digital sphere, compliance is very much important. So compliance of the operator also be important. So now I try to bring the second agenda, particularly garments worker payments. So it is a special time. Prime Minister is very much concerned on that issues. So a special government directive coming from the government, and that also in private sector, the same problems, you know. Popularly we know the number of worker is 40 lakhs, and the owners associations also be make pressure to the government, and that number need to be give their salary. But Prime Minister have one kind of information from their think tank. So this number is not correct. So he give a directive, we pay the money, but that money should be transferred through MFS. And he also give another direction, not single operator. So distributed 4 operators, and that's also a handpicked model. 50% get by Nogod, government, it is a public by entity. And because 25%, it is a totally private entity with international investment, sure cash and rock. So that is, and government also give a directive, cost must be reduced. So that is a special thing. So it is an ad hoc selection basis and target achieve. I think that is a good example. So you see, issue is that particularly market dynamics. So, and people choice. So we need people choice. So people have to right to choose their own operator as they like, because sometimes you select some operators, they have not enough agents, so they are not giving service from them. So in that context, voices for the beneficiary need to be raised from the think tank organization, research organization, and the journalists, and it works. I am one of the person who write that 2 issues and engage with the policymakers as an individual with Bangladesh banks and others, and I get some results. And I'm talking that story from that experience. So freedom of choice is very much important, and it is a issue, digital literacy. But you see, we have a story, because when I work with Grameen Bank, so Grameen phone is a issues, how the rural people use that high tech, but they started the digital journey. But irony is there, is still now microcredit is not disbursement through digital space. And we have a 2 big company owned by the 2 big NGOs, corporate NGOs or banks. One Grameen Phone, that is Grameen Bank, and Bikash 51% owned by Bragg Bank and and BRAC also. So through that experience, I take 1 or 2 minutes. I need there a synergy, need to be built the synergy in 3 areas because it is a new journey, new digital research resource we are building. But we need to be engaged innovative way with new partnerships that needed, that have a huge gap. So really change maker, we need to be engaged with the change maker, need to be learned from them, not from an academic fashion. We need to partnerships with the field and the academia. We need to be know from them also. A new mindset. It is a new journey. Open your mind, learn from everybody. Different stakeholder is there. Need to be sit with them. Need to be know the process, and then work on it. And alliance and partnerships. We need new alliance and partnerships with government, private, tech, and fintech companies, and the research and the and different multidisciplinary personnel. So thank you again. If I take more time.
Thank you so much, Mr. Ali, for that very enlightening presentation with some specific examples of what we can learn from some of the experiences. Now I'll move on to Mr. Zhao Zheng, Dr. Zhao Zheng from China. He's a professor at the Institute of Public Administration and Human Resources of the Development Research Center of the State Council of China. And we are actually running about 15 minutes late as part of the schedule. So I would really appreciate if we could, keep to our time. Thank you so much, Dr. Zhao Zheng for being with us today.
Okay. Thank you, Mr. Chaudhary. Good afternoon, ladies and gentlemen. I'm Zhao Zheng, come from the Institute of the Public Administration and Human Resources Development Research Center of State Council, China. My topic is local digital governance. I'm really delighted to attend this conference and share some opinions with other experts. My presentation will be divided into 3 parts. First of all, I will talk about the Chinese experience of local digital governance. And then I will talk the challenges. Last, I will offer some solutions about how to improve the ability of local digital governance. Okay, I will start by talking about experience of Chinese digital local governance. As we know, the new round of the Industrial Revolution and the technological change represented by digital technology as affecting people's production lifestyle in all directions. In China, in recent years, China's local government make great efforts to push the digital governance. According to my team's investigations and field survey, there are 3 experiences in China's local digital governance. That experience I public service, community level, and community building. We have found that local digital governance can improve the quality of government public service. and to uphold law and order at the community level, and to build a better community. For example, in Hangzhou, a city of Zhejiang province of China, has built digital Hangzhou and contract 11 applications in all of the fields of the public services. If you want to start an enterprise, it will take just one day. We will finish it. Another case is the community WeChat groups in China. Residents can easier to reflect their problems and participate in public efforts by the digital platform. That's very timely and feasible to get government's feedback. Yes, okay. Let's move on to the next part, the challenges. Challenge one, I think is a spatial digital governance divide remains. As we know, in light of different conditions, there are some difference between regions, especially between urban region and rural region. Due to the imbalance in spatial development, digital governance gaps still exist between different regions, especially within regions. Meanwhile, the new round of technological innovations and applications tend to high-pending spaces with good businesses. Some rural region has low developed in digital governance.
Professor Zheng, you have less than 5 minutes left.
Okay. Challenge 2 is capacity to provide digital social service and governance need to be improved. On the supply side, local governments need to speed up digital transformation. On the demand side, the value of the existing social data needs to be thoroughly explored. Number 3, the challenge 3 is institutions for digital governance need to be improved, especially safeguard the provision security, provide information and data security. Meanwhile, we need to build the performance evaluation system for digital governance. So in the future, I think there are 3 solutions for us to hope for. One is strengthening integrate planning and spatial layout for balanced allocations of digital governance resources. We need to like the regional central cities, metropolitan areas, and urban clusters. I play a driving and key role in improving the governance and promoting the building of the digital villages. Solution 2 is promoting two-way empowered of technology and society, as well as balance and balanced supply and demand structure for digital social services. We need to improve the ability of the government, local government, and link digital governance and digital economical to stimulate demand for social data. Last solution is convince that smart governance and institutional governance to balance digital governance mechanisms. Firstly, to build local digital governance system, and secondly, to establish a sound system for performance evaluations on digital governance, especially to build a clear and concrete specific indicators to evaluate digital governance. And last, we need to encourage practice and institutional innovation at the local level. And that is very useful for other regions, other local government learn from each other. And all in all, I think good governance makes a good development. So I hope when as a trend, digital local governance with both opportunities and challenges. We need to make great efforts to push the good digital governance to build the good, better digital society. Thank you.
Thank you so much, Dr. Zhao Zhang, for that presentation and giving us a framework for how improvements can be made. Next, I'll move on to another side of the world, to Egypt. And the next speaker would be Ms. Shama Zaglul. I apologize if I mispronounced
You
it.
pronounced correctly, Shama Zaglul, yes.
Thank you so much. Yeah, I actually lived in Egypt for about 3 years.
Oh, wow.
So brings back a lot of memories. Yeah. So yeah. So thank you so much. And Ms. Zaglul is a research consultant in Egypt.
Yes.
Over to you. Thank you so much.
No. Let me just share my screen. No, I'm sharing now the screen, sorry. So yes, thank you so much. It's my honor to be with you, all of you today. Are you hearing me well? Yes. So I would like thank you, Dr. Amran Mateen, for invitation. Sumala, Shamail, just bear with me for all the communications. I would thank you, all the speakers. Like, there is nothing left to speak about, because you just covered all the aspects about the inclusive digitalization transformation in your countries. I'm going to give you overview at what we are doing here in Egypt, and the situation of the social protection and digital transformation as well. I will try my best to be quickly as possible. I know we are running late, but firstly, I would give you an overview of what's going on with social protection in Egypt. Let me see. Oh, I like the point. So we are here getting kind of one of our powerful program called Takaful and Krama, which is in English, Solidarity and Dignity. So we are running this for 5 years now, and we are supporting by this program of around 3.5 families all over Egypt. And this families, if we are speaking about the numbers, it's kind of 15 million persons individually, between the disabled people, poor people, orphans, people with an under poverty line. So the Egyptian government just pledged so much to give them the support with all the economic measures change that we are facing nowadays. So, and we are allocated as an Egyptian government allocated the 30 million Egyptian pounds to have a very solid infrastructure, technological infrastructure in Egypt. However, of course, that will, I'm speaking about the like kind of like a big picture or the like sweet dream picture, but in the real time, it's totally different. So we getting this program, but at the same time, not all the beneficiaries included in this program. And I will tell you why. Through a study, I started this study like in 23rd of September 21, and it covered until like 20 January 22 as well. So it's almost like 4 months. And I did like a social survey. I questioned around 130 individuals from the front lines in one government called Asyut. And Asyut, I chose it because of 2 reasons. Asyut is one of the very, very poorest cities or government in Egypt, and even by United Nations, like they classified as a like people there, they don't have even the under poverty line because they already very, very poor. And the second, because I'm originally from this town, so I know the cultural mentality there. So I just wanted to have a small scale social survey, and then I will generalize it afterwards. So
but could you please go on slide share mode again? Oh, no, it's working now. Working now. Thank you.
It's working.
It's working.
So yes. Do you see the table?
Yes, we can see the table.
Okay. So yes, so it's kind of like this table. Let's give you an example what kind of social units that I reviewed. And I started with the 140 first front lines, and then I reduced it to 130 as the stability goes up. And I did this social survey with 13 questions about how digital transformation help or improve the social protection services, and specifically for the Takaful and Krama program, and how the beneficiaries knows about all this services that the Social Solidarity Ministry like provided to them. And I used as well a kind of Guttman stability coefficient, enable to know or like having a stable coefficient for my research, and examined the this scales like between 1 to 10. So if you are happy with the service, you will go up to 10, and if you are not happy or disagree with the service, that will be go to until 1. So I found lots of findings and challenges as well. As long as all the speakers spoke before about the challenges that facing in their government while they are trying their best, of course, to provide a good service delivery to their citizens, we have the same situation here in Egypt. We got like what we say that it's a kind of like sweet dreams, like we put everything in like orders. We got cash transfer system, electronic wallet. We encourage the other like stockholders and social solidarity ministry to support each other and got networking with each other, so the beneficiary will benefit from the quickest service delivery. However, we challenge a lot of things here because we have a very rigid organizational structures. So people are not willing to share any information. We got very, very weak technological infrastructure. So if in terms of the database, we are not coverage all the areas like the affected areas by, and who needs, of course, the help or supporting from the government. One of these areas is Asyut, and it's very excluded for many, many years. And when I went there to conduct my social surveys in field, I struggled because there is no grassroots organizations working on the ground there. And all of them, they based on kind of like donation. They are not getting any support from the government or from even international donations, donors as well. So, and of course of the front lines, even like some of them, they don't have emails. They don't know how, like they don't know how to access for the computer system or like I'm talking about the front lines that should be trained and qualified enough to deliver the service, as well as the, of course, people there, they are very, very ignorant. Most of them, they even didn't have their education. So they don't know how to read and able to let them just apply for the service online or get them with the platform so they can have an interactive communication. And most of the time, the internet connection there are really very weak. So they struggle for many ways. So I'm just like having like a big picture, like to what's happening in the ground there. And then when I surveyed the social workers, they give me lots of update that they need support. They need to have a kind of like decentralization, because we are very centralized government. So everything is coming from the capital, Cairo. There is nothing to do with the local services or local governance. And I think that we got the same, I get the same clause for all of the other like previous honored speakers. You got the same situation as well in their country. So I think we need to do something related to like build partnership or network, as Mr. Shaukat mentioned before, to like having included as well the grassroots organizations with the academy, instead of like everyone will have a block like alone or individually. And yes, so I surveyed them and asked them, like, this is kind of like examples what I asked about the availability of electronic registration system in this particular program. I asked about using of the online platforms, and most of them, like, they say we use it, but it ends up like they don't use it. Tracking the status of the beneficiaries, if they are having update information about if each beneficiary or not. And lastly, like we have as well the citizen lack of knowledge about the service update that Social Solidarity Ministry are providing. So there's no awareness, there is no kind of like novel business model we could apply there, because people, most of them, as I said, ignorant, or they are not caring about what the government provided to them, because there is like a trust gap between them and the government. And the two major obstacles I confront there when I'm implementing this, the weak in technological infrastructure, and there is no independent management, which is decentralization that I mentioned before. And the front lines are not willing to help as long as they are not trained enough or qualified to using this technological tools. So, and they are not willing as well to accept the change within the local social unit. And this is a different thing, because the mindset there are totally different than the capital. They are not accepting like strangers from like outsiders, I will say. So as we are working in many aspects, I just provide some recommendations to the government to deal with or like improve the social protection program there, just like adopting a new policy, like more effective and inclusive policy to include people like other, like just like in Asyut city, to be in the decision-making process. And how the institutional and organizational accepting the change like within the institute itself. This is something really important they have to focus on. Maybe they can just start bring some front lines to the capital and train them there, and give them back and try to let them train other front lines so they can locally trained as well. And for the social welfare institution, I would love them to provide kind of like novel business model, just like online platforms, one of the one-to-one interactive communication channels with the locals there, having the following up and assessing if this is the databases are really updated like day by day, or there is any mistakes, they are just like dropping any beneficiaries or not. And then finally, I would love them to spread the awareness among the beneficiaries about their services and how they can go to the service and get them on the board with them in the databases. So this is for me from Egypt. And I would love, of course, to hear the questions. I hope I didn't take long time, and it was always my honor to be with you. And if we have any future partnership or networking, I would love to happy to be part of it. Thank you, Dr. Imran. Thank you all. That's it.
Yes, thank you, Ms. Daglul. Thank you to all the speakers, actually. I hope that everyone is still connected. Yes, we have about 10 minutes for the Q&A. And is there any burning question that somebody wants to start off with, including the speakers? Any hands going up? Yes, please.
Hello, my name is Rafsan. I work for BIGD. The digitization of government services, we have seen a few, I'm gonna talk in terms of Bangladesh. What we're seeing is recently when COVID hit, when the government tried to provide relief with MFS, they said first they wanted to give digital cash transfer to 50 lakh, and then they reduced 16 lakh people because a lot of the information weren't adding up, and then some discrepancies and a lot of corruption, of course. People who didn't deserve to be in that list were in that list, so they reduced those 16 lakh people. So my question is, like, do you during your studies did you notice that it starts off the financial the MFS issue starts off with beneficiary selection, and if you don't have a powerful like beneficiary selection system, then you start off with a list that is full of the people that are not eligible for that service. So it looks like that digitization is helping in a lot of aspects, is removing the middlemen who are problematic, but in the beginning it all depends on the governance of beneficiary selection. And my question is, how does digitization compensate for that governance problem in particular? Question to both of you.
Can I choose this? Okay. So I'm interested to give your answer. So when you pick the word corruption, so I have a little bit concern on it, because master role. So when digital system is not exist, so it is done by the local government official, and they bring a master role, and through that way there is a pilferage what you are bringing, that is possible. So when you see in my presentation, I bring the word KYC, and the Indian fellow, he also bring the word KYC. So KYC means know your customer. It is a banking term. So that the same thing, it is happened. So for that reason, it is reduced. So I am very much concerned on that issues. And I know most of our researcher in television and the media coining that types of word, corruption is happening. But you see, digital system have one kind of muscle to pick the right person also, if you have a good intention. That is more important. And it is not on technology, it is on human being. So you see, in Bangladesh case, so you are using ATN. So in Bangladesh case, MFS agent became a human ATN. Bangladesh is a case, technology, higher and lower technology interface is there. So highly technical thing is happening through Bikash, Rocket and other thing. But a very illiterate person, maybe, but semi-literate person, 8 or 10 grades, they are giving that service. So it is an interesting thing need to be understand rather than, for that reason, people like young people, when we are coining the word from bad for the whole system, to grow up the whole system. So I think we should be more concerned about it. So targeting, it is a separate agenda. So digital system cannot do it. So it is a totally governance issues. It is a local government, and it is related with political economy. So people choice political supporters or something else. For that reason, that is happening. Thank you.
No, I'll agree with Mr. Shekhawat Ali. I mean, I won't comment on the Bangladesh case, but in the other cases that we've studied, corruption definitely is a part of how the targeting is done. And we've seen from studies systematically that, there are three kinds of fraud: eligibility, quantity, and identity. Identity fraud can be stopped, but it's difficult to completely stop eligibility and quantity fraud. That keeps happening. Even if you have a database. And you're completely correct. The targeting itself and building up of the database itself is a very political process. And I don't think we have any satisfactory answers as yet, except to be mindful of the fact. Now, in very donor-driven systems, it is possible to feed it into the ear of the donor saying, be careful, you're doing this, in crisis and humanitarian situations when digitization is happening, it's possible. But when you have and this was from an earlier conversation today, when you have more self-aware governments who know what they're doing and why, then the controlling for the political economy becomes very difficult. And then given the constrained circumstances, it's more work like researchers are doing in India or in Kenya, more civil society activism, more legal activism. That is possibly the only way out, but it's not to throw the baby out with the bathwater. This definitely does help. It's about how to be aware of what can go wrong. That's how I answer your question.
Thank
Any
you
other?
very much.
Yes, please.
For giving me the chance. My name is Zubair. I am a manager of MIS in BRAC International. So before coming to BRAC International, I worked in another BRAC program, particularly with RMG workers for 5 years. There we had piloted the digital financial service with the RMG workers. And my experience says that before the COVID pandemic came and before the PM Hasina gave the decision that the salary will be distributed through the digital means, before that, from Bikash or MFS, we have found stories that the women are not at all interested to take the digital service because their entire salary has to be handed over to the husband, and husband knows the Bikash password or the MFS password, so the money doesn't help her at all. And another thing is to this sir, the question is that what is good intention and how do we measure this good intention, that how much good or to which extent? Could you please elaborate?
So very interesting sociological issues. So you see, password never be shared to anybody. So, but it is a sociological issues. Husband know the password of his wife. So in other way, I just disclosed the number. The RNG owners, they claim the number of workers is 40 lakhs, but it is decreased, not only 50 lakhs of PM issues. So it also be decreased 28 lakhs. So in our society, every time we try to give big number, and that big number is a issues of political economy, and it makes the corruption. If they can convince the government 40 lakhs, then 12 lakhs salary money can be get by the government for the worker, but that money not to reach to the worker. And through that way, political economy issue is coming. And another very interesting observation also becoming after COVID, the owner of the RMG, they are not interested to give the money through MFS because it is related with income tax and their compliance issues. So you see, it is interrelated political economic relationships, very much political economy relationships, and informal sector, because a lot of things in our economy going on through informal sector. So when someone enter in digital world, he is accountable. He is accountable. He is located. If he doing a bad thing, it also be located. So that is the good thing. And so different stakeholder power, those who have, they try to be manipulated within that digital system. So new kind of rule they invent and they corrupted the system. Thank you.
Thank you. Yes. This would have to be the last question, I believe. Please, yeah.
Thank you. I'll be short. I wanted to address the MFS point again. That was a fantastic presentation, but I have some concerns that I'd like to raise and hear you respond to. So I think MFS as a medium for social transfer and like a primary medium of digital transactions for money and stuff has a lot of potential, but I'm worried about data privacy and the data commodification when, especially given that these MFS platforms are often private sector entities and how much power they have when they are able to sort of monitor and track or even develop patterns or generate patterns between user transactions and the way that they use the money that they have in their account. The other is the scalability of these systems as a form of social transfer, given that it is still dependent on the agent network, especially on the grassroots level, where if the money comes into their account, they would still have to withdraw it from their agents. And finally, the high transaction costs associated with making digital payments, be it when you're cashing out or even like, the rent that you'd have to pay to the agents or whatever the income that they're generating from this model as well.
Have you any MFS account?
No, I personally don't.
So if you have, so many questions you can solve. So it is very middle class elitist question. You see, I mentioned our ex-governor, Farashuddin, Dr. Farashuddin, he raised the question, the price rate is very high. So we have to know the different stakeholders who are engaging with MFS system. So regulation part, Bangladesh government, Bangladesh Bank, and then MNO, mobile telephone operator, so BTIC, that two regulator particularly work for that system. And there is a licensing operator, that is MFS operator, and they have a distributor and they have an agent. So 18.50, that money, 1,000 taka for transfer, that is distributed different stakeholder. Government cut the VAT and tax first VAT, then MNO also get their service charge, then very large number of interest get by agent and distributor, and overhead cost and other thing happening. So BIDS, I engage with BIDS study, impact study on MFS. So in 2019, 1,000 taka, only 47 paisa they make profit. So it's still now MFS is not profitable concern. So that is your pricing issues. And safety, data safety, it is a common agenda. You see, MONO, how much SMS you get from different business entity. So already BTRC give one kind of direction, and for that reason it is decreased. So we need to be operate through regulator. That is more important, because my information, how it is disclosed to the private entity.
Thank you so much. Ms. Rai, would you?
Yeah, if I may very quickly respond to your question. You're right, there are privacy concerns and you're right to have them, but this is also an ecosystem which is beginning to develop. And this is not an ecosystem that can be developed just by the government on their own. There are capacity issues, there are technology issues, there are also issues of, being able to take on the risk. You would need a risk sharing. A private public partnership is the way to go. If you remember when I talked about it in my presentation, there are real concerns in terms of, let's say, how GST, general sales tax data, is being trapped in India by what we call quasi-government entities. And I assure you, I don't think that's anywhere as far as you're going in Bangladesh, because in one sense, the macro-political economy context is very different. There is, I would say, as I said, far more self-awareness on the part of government and the private sector here in terms of what drives accountability, what are the developmental agendas. So I think we will also have to have some kind of, we will also have to, in our minds, have some kind of leeway for how far the private sector goes, because this is not a trajectory that we can go down without private sector involvement. But equally, the checks and balances that we are talking about, so maybe have more competition. There needs to be more contestability than having a sort of monopolistic or an oligopolistic structure. Those are really the ways out. But the private sector involvement is going to be necessary going forward. What's important is how this is regulated and how accountability is really shared out. That's what I'd say.
Thank you so much to all the speakers. So we're just wrapping up. I mean, in the interest of time, we don't have too much time, but I think we had a very engaging discussion from all speakers from India, from China, from Egypt. So it was a very international kind of perspective on things, and we learned some very interesting concepts came up, such as how to tackle the exclusion criteria, a framework for essentially tackling that. A very interesting aspect of the adaptive social protection. I think that's a very, very interesting idea of how programs should be designed, so that it's not really designed at the outset, but designed in progression as you're learning from the ground. And that's where a lot of use of data comes in, because I mean, now with digital systems, we are ending up with a lot of data that we may not be using as interestingly or as efficiently as we could have. And then of course, the issue of the individual choice of MFS. I think that was a very key issue. That unless that is taken into consideration, different kinds of exploitative factors may come into the system and competition, and then it's ensuring fair competition. So I think we learned a lot from this session. It was very engaging, very enlightening for all of us, and I hope that the government of Bangladesh, the governments of India, the governments of China, Egypt, all take this into consideration as they develop their ecosystems further. Thank you so much.